everybody. I'm Jess. I'm with the Avalon Foundation, and we're back with Ask a Provider, which is done in partnership with Chop Tank Community Health. And today I'm here with a friend of mine, Chrissy. She is the director of community-based programs for Chop Tank. And what we are here to talk about today are your school-based health programs. So I want you to start by telling me, what on earth is a school-based health center?
Well, I could talk about them all day. So thanks for asking. So our school-based health center programs have been around for a really long time. We started providing care in schools in Caroline County 20 years ago. And since then have expanded the programs into Talbot County Public Schools and into Kent and Queen Anne's County Public Schools. So they are literally a doctor's office in a school building. So we have a nurse practitioner or a physician assistant that come into the school at least 2 days a week to provide medical services to kids and school staff in any way they need it. So for a lot of our kiddos, it looks like urgent care. Instead of coming to school, they can be seen right at the school. They can get any testing that they need, any medical services that we can provide, ruling out all the yucky kid germs stuff that kind of goes around. And then parents can come pick them up if they need to be picked up, can go to the pharmacy, grab a prescription, and be all done. So it can look like urgent care.
I guess I feel like this is where a lot of confusion lies. So your kid is sitting in their classroom and they say that they're sick and they get sent to the nurse's office. Like, how is what you're talking about different than a nurse's office? And how could my kid get this kind of care in the school-based health? Because it's not the same as just saying, oh, your kid has a fever, you need to pick them up. It's like, oh, your kid has strep throat, you need a prescription.
Yep. So what happens? Yeah. So if you have a kid at school that gets sick, they go to the nurse first. So we're really close, and our partnerships with our school health rooms are really important, because what happens is, instead of getting the phone call, hey, your kid's got a sore throat, you got to come pick them up, they will also say to you, and wellness is open. And then they can send them over with parent permission to the school-based health center, where we would swab their throat. We would evaluate and diagnose strep if that's what they had, or rule it out if they don't. And, send that prescription and kind of complete the whole visit. So it's the whole entire thing is done for you while they're right at school, moving from the school nurse's office over to the school-based health center, where they see a provider, a nurse practitioner, or a PA.
And do I have to be there for them to get that throat culture or get that service done?
Yeah, you don't. So we have a consent form that goes out at the beginning of the school year that gives the parent opportunity to look at the services that we provide, and to understand how the program works, learn the schedule and things. Once you complete that, as long as you want your student to have, or your kiddo to have the service available to them, we always call first, but then you don't have to come in for the appointment. So for example, today at the elementary school I work at, I've seen a kid with a sore throat, no fever, swabbed the throat. It was negative, probably just allergies, and was able to send her right back to class. So mom and dad didn't have to come at all for a pickup, for a doctor's visit or anything. We were able to keep the kid right in school, which is really great.
But Chrissy, I really love my pediatrician. I've been with that pediatrician since my babies were born, and now they're in high school. Like, I don't want to disrupt that relationship. Can you speak to whether I should consent for my kid to be seen by Chop Tank while they're in school?
I can. We don't want to disrupt that relationship unless we're the primary care provider. Unless you use Chop Tank for primary care, we very much act as an urgent care. And so we communicate with your primary care. So if we saw one of your kids in the school-based health centers, the same day as the appointment, we send all the information about the visit over to the primary care office. So if you needed that follow-up the next day, that information would be readily available to whoever you guys use for primary care. We give you reminders to schedule those well visits, or to follow up on some chronic care issues that kids might be having. And we can even help facilitate that, even if your primary care is not Chop Tank. In no way do we need to replace that service if a kid already has that in place for themselves.
So I guess there's kind of two tracks here. One is, if your kid does not have a primary care physician, then parents can reach out to Chop Tank about assigning you as a primary care physician. But if you're like me, you do have a great relationship with your pediatrician, then I can think of this as going to your doc's in, or the urgent care facility.
You got it. Yeah. And we certainly can offer that primary care service, but for families that don't need it, we can still make that convenient care available at school for them.
So, but then you get slapped with a big bill at the end, or do you take insurance? How does that work?
Well, exactly like urgent care. So if you go to urgent care and pay your copay at urgent care, it would be the exact same copay that you would pay for us because we take all private insurances. We take Medicaid. We also have a sliding fee program. And so, we do want to make sure we get connected with families who don't have insurance because often we can provide services out of the school-based health center for a lot cheaper than it would be for them to pay out of pocket other places.
And so I know like I'm hyper focused on like the sniffles and when you're getting that call from the nurse's office, because I think that that is like what upsets my world the most. But you provide others like well services and also even some dentistry for kids, right? Can you
We
speak to
do.
that a little bit?
Absolutely. So every year, our dental team travels through all of our schools and provides dental services for any student who's enrolled in the dental program. And those services can be a cleaning, it can be fluoride application, sealant placement, or it could just be oral health education. So a lot of us have a dentist that we see regularly every 6 months, but our team will come in and just provide, toothbrush instruction or, some recommendations on, how much plaque they have and what could cause that. And or if they need that cleaning done, if they had been to their dentist more than 6 months ago and they want to get that cleaning done in a convenient place, they're able to provide that service right at school. So additionally, we are working on adding some behavioral health services within all of our school-based health centers and some other educational opportunities around health and nutrition. So we really try to focus on the whole kid and keep them healthy because, healthy kids learn better. So if we can keep them in school, then, they do much better. It's more convenient and they do great.
I love that. So I really know that it sounds like using the school-based health centers are both, convenient, they give you peace of mind. We know that they're getting quality care. So break down for me what steps I need to take to make sure that my kids can participate in the services that you provide. Like what is the next step? If you convinced me that I want to make sure that my kid can get that throat culture or whatever it is, what do I need to do?
I think most families are already connected with their school health rooms. And so probably the easiest way to connect is to call the nurse's office at your child's school and say, hey, I heard you have this CHOP tank service with school-based health centers. Could you help me get my kid enrolled? And so we have an electronic enrollment form that's also available on our website, choptankhealth.org, or your school health room is really the easiest connector to care. They can help you make the appointment. They can help get you the paperwork that you need. They can give you the number for the school-based health center at your child's school so you can connect directly with the provider that would take care of your kid at school.
And like my kids are older, but like if you have a child that's at the elementary school, but then you have a kid who is not elementary school aged, like can they still utilize these health centers? Like who has access to be able to receive these services when you guys are open and in the elementary or middle schools?
Sure. So we really focus our programming in the school on our school enrolled kids and staff. However, a lot of times, if we have a family we care for that uses CHOP Tank for primary care, we can see the whole family at the same time. So instead of running, to our Easton Peds office for an appointment and then back to the school for another appointment, we try to make it as convenient as possible. So we'll often see younger siblings with older siblings, or if our elementary school-based health center is closed, we can use our middle school school-based health center to be able to provide that wraparound service. Because once you're enrolled, you're always enrolled. So you'll be able to utilize the service in elementary, in middle, and in high school.
That is this is so cool. It's such an evolution from the days that I was in school and thinking about my time in school nurse's office, where most of the time I was just trying to get my parents to come pick me up.
Yes, and miss a whole day of school. So now when we see kids and we feel comfortable with them staying in the building, we get them right back to school. It's a blessing for us, but it is a change in what we're used to, and we're just really excited that we can provide that really convenient, like at the moment service for kids and get them back in the classroom safely.
Chrissy, I always love talking to you. I really appreciate your time today. And I encourage everybody who has kids in the public schools to check out CHOP Tank Community Health and the school-based health centers that are there. Actually, let's name, like, is it all the schools in Talbot County?
In Talbot County, we're at Easton Elementary, Easton Middle, Easton High. We're on the St. Michael's campus, and we also go to White Marsh Elementary School. So almost all the schools.
Almost all. So stay tuned for more. It's great talking to you, Chrissy. Thank you so much again. I'm Jessica with Ask a Provider, signing off.
Thank you.